recording. I'll record this one. I haven't actually introduced myself. My name's on the slide there. Anna Gardiner. I lead the part of the health team at CDC, the part of the health team that does the sort of systems improvement and change management work with my colleague Saskia.
Hi everyone, I'm Saskia Jenkins. I'm a programme manager in the health team at CDC with Anna. And although we are the health team and we're talking about integrated care systems, really most of what we do, or pretty much everything we do, is around multi-agency working across the SEND system. And that is how we'll be approaching the session today as well. So whatever your experience or involvement has been so far on integrated care systems, we really want to hear from you and your experience, whether you've been very closely involved in the development of your integrated care system or whether you really haven't been very involved at all. And we want to hear equally from all of you.
Absolutely. Okay, I'm going to get started. As I said, we have some information to talk to you, to give to you. So we're going to cover what you can see on the side there. So we're going to start to think about what ICSs mean for SEND duties that previously sat with CCGs, and also for delivery and practice. We'll update you on the guidance that exists already and guidance to come out soon, and accountability being the word of the morning, I think, from the plenary session. We had lots about accountability. We'll also think a bit about and take a steer from you as well on system readiness and response. I know NHS England has closely been working with ICSs on their readiness in relation to SEND and developed heat maps. We know kind of key themes that have come from that, but really keen to hear from you about what that feels like locally in your own systems. Think a bit about your kind of hopes and fears for systems as they're emerging, and a chance to share collective knowledge. We also are going to talk about a resource that we'll pop the link to in the chat, which we developed. I think what we knew as we were developing it is that this is such a fast-moving space that it will need to be reviewed and updated. So what we're hearing from you today in this session and the previous one will help inform what that resource looks like in its next iteration. And also from that workforce survey that I talked about in the plenary session, that a real kind of worry, I suppose, one of the things that was keeping people awake at night is this move to integrated care systems, and a lot of incredibly hard work getting to some really good partnerships with CCGs around SEND. Worry that will be diluted, that will look different. So we know it's a real challenge, which is why we put this workshop on the agenda today. But I suppose just managing expectations. There's only so much information that's out there. A lot of what that information will look like going forward will come from the conversations we have today. So hopefully a bit of a mix of telling you what we do know and listening to you, and using that to shape our conversations. So again, apologies if this is not new information to you, but integrated care systems replaced CCGs. They were born on the 1st of July, so they're still pretty new, emerging and finding their feet, I guess. So previously 110 CCGs, we now have 42 integrated care systems, so they're operating a much bigger footprint, so 1 to 2 million population per system. We'll talk a bit more about what comprises an integrated care system shortly as well. So they're based on the principle of integration within the health system, so across mental and physical health, acute community care, but also between the health system and other partners, which working in SEND is our bread and butter anyway. They've not come from nowhere, so they came through the Integration and Innovation White Paper, were enacted in the Health and Care Act this year, but areas have been working on these bigger footprints around some themes. So we've had sustainability and transformation plans, partnerships in the past, so that they've kind of evolved into what we now have as integrated care systems. We at CDC do lots of delivery work. You probably know us as a delivery organisation, but we're hosted by the National Children's Bureau, which is a bigger charity, which runs the Health Policy Influencing Group, Saskia being a really key member of that group, which brings together the children's health sector, so lots of children's health organisations, charities, and through that we did a lot of lobbying and influencing around the Health and Care Bill as it was. Initially that legislation was really adult focused, August. But now, and I will absolutely celebrate the achievements of that of the sector and that group, there are several key duties that are related to children and young people, which are on the screen there. So integrated care boards must consider the needs of children aged 0 to 25, including those that SEND in their joint forward plans. We'll talk about those plans later. The ICB, so the Integrated Care Board, and the Integrated Care Partnership must consider a diverse skill mix when appointing to their boards. And again, we'll talk about the difference between the B and the P there shortly. ICB annual reports must include how they have met safeguarding and their SEND duties, and ICBs must have a named children and young people's exec lead at board level, and that's who'll hold the remit for the SEND accountability. What we are seeing in practice is that ICB exec lead tends to be the chief nurse. So lots of the chief nurse roles have SEND clearly in their remit and portfolio. I'll keep moving on, but do pop any questions or thoughts into the chat. And now Saskia's already put the link to the fuller resource that this infographic comes from, which was and yes, Michelle, ICB replaced CCGs. The system is the overarching entity, but the Integrated Care Board is where the CCG statutory responsibilities sit. And I'll unpick that a little bit more in a second. But like I said, yeah, the system overall comprises an integrated care board and an integrated care partnership. Some new terminology that we'll be using is expanded on in this graphic. So system is comprised of multiple places, places being kind of not exactly, but a local authority footprint. So that kind of smaller or that local authority footprint as was, and then even smaller than that down to neighbourhood level. The graphic that you can see here is our kind of attempt at mapping what that might mean for SEND, but I think we'll be really honest, we don't really know what it means for children and young people. And in the previous group, we talked a lot about ICBs not having clarity on their priorities in general yet. So actually, like I said, this is just a kind of starter for 10 and something that we'll need to adapt as we go. I'll keep going. We'll unpick a bit more of that as we go. So the Integrated Care Board is the bit of the system that brings the health partners together, so the health system together, and that's responsible for commissioning the healthcare services across the whole ICS footprint. And as I said, the statutory responsibilities that were previously held by CCGs, so the duty to joint commission, duty to engage and in the HC plan process, those duties all sit now with the Integrated Care Board alongside safeguarding duties. And that board is also responsible for developing a 5-year forward plan. So a really clear sense of what their priorities are and how they'll address them. Then the other side of the system is the Integrated Care Partnership, so the ICP, which is the kind of multi-agency part of it. So where the NHS comes together with local authorities, multiple local authorities, depending on the makeup of a system. We know that there are some systems that have as many as 8 local authority partners within their footprint, as well as other key organisations, so housing providers, the voluntary and community sector partnerships that are required to plan, to understand and to plan and meet those wider health and care needs across that footprint. And they also should develop a strategy, and Saskia will go into a bit more detail on that later. So NHS England and DHSC have released some guidance. We know more to come. But at the end of July, they released some guidance on integrated care strategies and what those should contain. So they must set out how assessed needs, assessed via the Joint Strategic Needs Assessment, which we know vary in terms of their robustness and in fact how much they discuss the needs of children and people with SEND at all. But that should feature and that should be a factor in how a strategy is designed and set out. Local children's leadership should also be involved in that development, so that to mean directors of children's services from local authorities, as well as the ICB, Children and Young People's Lead, who sits on the exec board, and children and families should be consulted in the development of both strategies. So that's what exists in terms of guidance so far, but more to come. Saskia, anything else you wanted to pick up on that slide that I've not mentioned?
No, I don't think so. I think we just wanted to give a bit of an overview of what is in the primary legislation and what is in the new sort of guidance, both statutory guidance and non-statutory guidance related to children and young people with SEND, because we know that now there is a sort of clear requirement in the Health and Care Act for ICBs to consider and meet the needs of children and young people aged 0 to 25, that some sort of local SEND leaders are using that legislation and this guidance to hold their systems to account as they start to develop their integrated care strategy, which is being developed at the moment, and as they will sort of soon develop their 5-year forward plans, using these bits of legislation and guidance to really ensure that children and young people with SEND are on the agenda of their integrated care systems in their area. But yes, I agree with you, Kate, about the language and the guidance is worrying in terms of families being should be consulted. And that piece of guidance that came out on the 29th of July had it broke down into sections, partners that must be involved, that should be involved, and that they should consider involving. And unfortunately, lots of services related to children and young people, education settings, and actually children, young people, and families themselves are in that should consider section. But as we will explain later on, there are opportunities to sort of influence the development of some updated guidance based on what they are hearing from based on what DHSC and NHS England are hearing across the system. So hopefully we can make that case as we go forward. So just wanted to give a quick snapshot of what this might mean for the SEND system, thinking really positively to begin with, and then reflecting some of the challenges we have heard as we're working alongside integrated care systems across the country. So broadly, we really agree with the principle behind the move to statutory integrated care systems around more joined up and integrated care, and the integration between physical and mental health services, and also between sort of primary and community care. And we know that that is particularly effective and necessary for children and young people, and children and young people with special educational needs and disabilities in particular, whose needs are already being met by a really broad range of partners across the system. So the opportunities that the move towards the integrated care model has for sort of formalising some of that multi-agency working could be really powerful. It could also be great to see sort of specialist services planned and delivered at that larger geographical footprint. So thinking at that 1 to 2 million population level, rather than the sort of 200 to 400,000 population level that we would see at a place or sort of local authority system. And the potential that has to be really transformative for some services that affect children with complex health needs. Also, the possibility of it being an opportunity to share good practice and common solutions and reduce duplication within individual sort of place or local authority systems that are made up under one integrated care system. So in our workshop just now, there was someone from an integrated care system that was made up of 12 local authorities, which I think is the most I've heard of. And just the potential that there could be there for sharing good practice and common solutions between those places and sort of more effective joint working. And linked to that, all the opportunities for sort of consistency, reducing a postcode lottery, setting kind of standards or good practice guidance at that ICB level that can really transform practice. And sort of just generally then our hope is that it can be a way of driving change for children and young people, and children and people with SEND specifically at that system level. And we're aware of some really good practice coming through in integrated care systems that have been doing this already for a while, like West Yorkshire and Harrogate, and hopefully we'll see more of that as systems sort of mature and develop. However, we just wanted to reflect the reality that this is a period of significant transformation for an already stretched health workforce. And although there are opportunities for sort of finding common solutions, we are also concerned about the potential for duplication and overlap of responsibility, strategies and agenda when it comes to SEND work that is happening at those sort of place-based SEND partnerships, and then now also happening at this new footprint for SEND delivery at that system level. We've also got real questions about how to ensure the necessary local variation is still facilitated, and we want to get your thoughts on that question of how much should it be about consistency and how much should it be about supporting local variation towards the end of the workshop. And also, questions about how children, young people and families are being consulted with during this transition, during the strategy development, and also in an ongoing way. And finally, just that question about how this change will affect existing collaborations and joint working with key SEND partners at place who will stay operating predominantly at that place footprint. So yeah, just kind of following on from what I've said, we see kind of real confusion still in the system about how this move to integrated care systems will affect existing partnership arrangements, and how well will the integrated care system understand SEND work happening at place level. And I think lots of that comes down to their approach to and the sort of visibility of SEND data and the feedback loop between what we know is happening at the place footprint and local authority level, and then what of that an integrated care system has access to. And we're doing some work in the Northwest on exactly that issue that I don't know if we'll have time to go into, but hopefully can do some more thinking about that. Also questions around governance arrangements, and again, the potential for duplication between governance at system and place. We're hearing a pretty patchy or minimal parent-carer engagement so far. And that quote there, that it feels like we're starting all over again, comes from a parent-carer forum rep at one of our workshops in Stoke the other week, who said that they had been contacted by the ICB with all of the same questions they were being asked by their local health system kind of 5 or 10 years ago, and that was quite a frustrating process. And finally, just what the visibility of children and young people generally and SEND is in the midst of this recovery agenda, which will be sort of at the forefront of all ICB chief executives' agendas going forward, and how it fits into Therese Coffey's sort of vision for the health system, which is this ABCD agenda, where A stands for ambulances, B stands for backlog, C stands for care, by which it's quite clear so far that what she means is adult social care, and then D stands for doctors and dentists. So we've got some quotes there from DMOs and DCOs that we've been talking to, saying, you know, sometimes SEND appears to be on the agenda at ICS level and other times not. So these are the sort of key questions that integrated care systems need to work through, and we are hoping to sort of over time develop a bit of a framework for kind of what we think good looks like and what we'd really like to talk to you about for the rest of the session today. So it's these really broad questions about what we think should be done at that ICS level versus what we think should stay at local system level when it comes to SEND. There's lots of questions about actually what the role of the integrated care system should be in this landscape. So is it about setting standards across the places that make up that integrated care system, or is it about just sharing good practice and actually supporting necessary local variation? At the more extreme end, is it actually about redistribution to ensure sort of parity and equity within the ICS footprint, and what is the role in delivery? And linked to all of this, you know, how integrated care systems are setting up their SEND governance relationships will inform kind of their approach to these big questions. And also that question of what the relationship is between multiple place footprints, as I've said, and that one integrated care system. So in that guidance that came out on the 29th of July that Anna mentioned, DHSC introduced this sort of principle of subsidiarity for integrated care systems. And this is the model that they are suggesting integrated care systems take, which is essentially that they do only what can't be appropriately done at place level, and that is the work that's done at system level. We know that that isn't the approach that all integrated care systems are taking, and we would really like to get your views and feedback on what you are doing locally. But this quote here about the 3 tests comes from some work of West Yorkshire's ICB plan, and they are taking forward this principle of subsidiarity. And what they've said is they've introduced these 3 tests to determine when it is appropriate to do work at that system level and when it shouldn't just sit at sort of local authority footprint. So that is when it can achieve a critical mass beyond population level, to share best practice and reduce variations, and to achieve better outcomes for people by tackling those sort of really intransigent and sort of wicked issues across the system that are really hard to fix just within one place. Final slide from us before we hand over to you, but just a note on sort of timelines. So by December this year, integrated care strategies are expected to be developed and published. Although in that guidance document, DHSC sort of recognised the fact that there's huge variation across systems in terms of maturity. So it's not kind of a legal must, but it is an expectation that we will see integrated care partnerships publishing their integrated care strategies then. And then by April 2023, integrated care boards must publish their joint forward plans. And as Anna said, following kind of work from across the children's sector, those plans must include a sort of account of the needs for babies, children, young people across their footprint, and also provision to meet those needs. And then DHSC is now committed to reviewing and refreshing their guidance for integrated care strategies once they've had a look at what those different strategies look like, and also once they've heard from the sector. So we're hoping that we'll be able to kind of contribute to that process with the messages that we've been hearing through our work with integrated care systems, but also through sessions like this with all of you. So that is a lot of talking from us, but we wanted to just kind of hand it over to you all from your experiences of different parts of the system. Our polls didn't work very well in the last workshop, but are you happy to, should we give them a go, Anna?
Let's give them a go. And if you can't respond to them via the poll, then just pop your answers in the chat or come off mute the old-fashioned way, whatever works best for you. But let's give the polls a shot.
Right, let's hope this works. I've put that in the chat and I will just share my screen now as well.
So if you click on the link in the chat, it will take you to a poll. The first question being, have you meaningfully been involved in the development of your ICS? And I realise that might not be part of your roles, but if it is, then tell us. So yes, some, mainly been consulted, attended some meetings. No one saying yes, very involved.
I'm sorry if you can hear that. I'm going to go on mute because I just had some window cleaners arrive that I wasn't expecting him to start cleaning.
Didn't hear anything.
I just moved, so I didn't organise that, but it's happening.
So
anyway.
Majority is a no, have not been involved meaningfully in the development of your ICS.
Let me just go to the next
Yep.
page.
Yeah.
So a similar question, but just trying to understand whether you feel like the level of involvement you've had so far is about right, or whether you want to have been more involved or more informed in the process. Just check if that's working.
Adeline says that hasn't moved on.
What about now? Is that working?
No, still showing the first one. Let's just answer in the chat. We had a similar problem with polls. So if you have been involved, have you been involved as much as you would have wanted, or did you think you could have offered more? Not involved from Sarah. Oh yeah, can we share the question again on this slide, Saskia? Hannah, haven't been involved. It's all happening at a level higher than me. Michelle says not involved. Oh, we've got the previous. You're on mute, Saskia. I think we're on the previous. We're having a real poll issue today, which is not the usual. And yet, Mary, that's fine. We didn't expect that everyone would be at system level and therefore involved. So on the screen there, you can see another question. So what SEND work or activities do you think should be happening at the ICS footprint? Either if you are on the poll and it's working for you, then that's great, answer there. But if not, answer via the chat. Hannah, would you expect the DCO to be involved? I would. Saskia, I think DCO is pretty key to that. Yes, that's a kind of CDC view, but I think, and an experience from other areas, I think DCOs have been involved.
I think one of the challenges that kind of came up in the last workshop as well is just a real lack of sort of clarity about responsibilities and who is involved and who isn't. And I think certainly as kind of most integrated care systems are developing their strategies at the moment, and that's meant to be being done in a sort of really multi-agency way, it would be good to see sort of key SEND roles, including DCOs and DMOs involved in that process. But I think we're aware that that definitely isn't happening across the system.
And a couple of comments that chime with other things we've heard from a parent care forum saying not involved, and no one seems to know where the parent care forum or SEND should fit. That does echo some of the things that we've heard elsewhere. An expectation that as DCO I was involved in the ICS blueprint, but not discuss with senior leads, SRO or exec for SEND. And a reflection that, which I also have pondered a little bit, is that the chief nurse has such a wide remit that is actual SEND sitting there just in name only, and actually where does the work happen? Natasha, we've recently developed a set of principles to support decision making for children with medical needs in schools across the ICB. So there is some practice and work happening in some areas. Expecting more involvement now that the chief nursing officer is setting her structures and team. Yeah, I mean, that, to be fair, I think some of those posts have only just been recruited to sound better to have a separate role rather than under the director of nursing is easily forgotten.
Is there anything else on this question of what you think should sit at that ICS footprint for SEND rather than sitting at place? What might be some of those key things that you would like to see happening at that integrated care system level? And yeah, those the things that have come in the chat are some really good examples. Meaningful data collection, I think that's really key. Shall I go on to the next slide, which is really just a similar way of asking this question, but we want to know what you think it is that should stay at place.
And governance coming up a lot, which it did in our last workshop. Really not clear yet what governance for SEND looks like within that bigger footprint and how that relates to governance at place level with SEND. Continuing care working well at ICB level, but work to do to get consistency of children's continuing healthcare and EHCPs. Yeah. One of the things when we think about this at CDC and see a bit of an opportunity is thinking about that that kind of low incidence, high need group of children and young people who may be in residential placements, and actually a real opportunity for ICSs to work better for that population of children and young people. Transition protocols, especially around adult services. Mary says setting expectations for engagement of parent carers and children and young people. Yeah. And I'm sure our colleagues at Contact will be, and the NMPCF will be working out what that might look like as well. And yeah, agree, Natasha, consistency in funding those children and young people with complex needs who don't have continuing healthcare or children's continuing care. Admissions avoidance at ICB, definitely. That feels right.
Sorry about all of the difficulty with polls. I think this should be working. I've just tested it out. It's a pretty broad question and it's already been touched upon a lot, but we just want to know kind of a snapshot of from what you have seen, and I know from what you said that the levels of involvement have been really different, but whether you feel the needs of children and young people with SEND have been sufficiently considered or prioritised within your ICS that develops. and either pop it here or into the chat. That's promising. A couple of yeses coming through. Don't think we saw that last time, but that's great.
I guess the next step is seeing priorities and strategies and seeing what the action plans around those are.
I think this point that's come up around SEND fitting across learning disability and autism, mental health and children and young people's programmes, with some issues not fitting anywhere, so it's fragmented. I think that's something we've heard before and is really key in terms of, you know, because SEND covers that 0 to 25 cohort and interacts with so many other systems, if that means it is actually lost in the governance arrangements that are being formed for an ICS, or an ICB, and also where that sits in strategy. So I think, yeah, absolutely agree that that's key. And then, yeah, another really interesting point here around, even though ASD or learning disabilities has a high profile, it always reflects adult models and children need more visibility. I can't see the chat, Anna, but I don't know if anything else is coming up.
I think lots of comments echoing that children and people in general not clearly demonstrated as a priority for the ICS, let alone SEND. A couple of points around therapies and some of the more fragile services that could be supported at ICS level.
And I just saw another comment come in just to stop sharing, which is about data and a lot more needing to be done to develop data at ICS level. And absolutely, we would agree on that one and are starting some work on exactly that. But if you have models that you think are really working well, please do share them with us. This is our final question. Or a final poll question anyway, around what are your asks for the system nationally, regionally, or from your integrated care system going forward? One second.
To do pop them in the poll if that's working for you, or in the chat. Come off mute. Consistency. Yeah, that was a key theme in the last workshop too. Clear information about the structures, where SEND fits and how parent care forms can be included. So governance and accountability and engagement, clarity. Accountability, the word of the morning. We know that that GM, Greater Manchester, as a system is doing some work around SEND and governance. We know that the West Yorkshire and Harrogate system has done lots of work in that space, but I think safe to say it's still in its infancy. Thanks for joining us, Rachel. We'll share slides. I'm going to pop the evaluation form in the chat if you haven't already completed that. Better communication and true partnership. Natasha says, nationally, think be helpful to have clarity on roles and the responsibilities for pupils with medical school needs, as still a lot of pushback in the system. And I know actually that NHS England, so Lorraine Mulroney's team, one of her new team members is tasked with a project around support in schools. So I know there's work happening nationally there. And data modelling. Yeah, perpetuates that medical model, absolutely. I think I put a link in the chat in the main session this morning about some work we've done on data indicators that are less linked to activity and much more about experience and voice. And Bedford, their presentation talked to that too. So I think that's the way forward.
I know we've only got a few minutes left until the end of the session, but I just wondered if anyone wanted to sort of come off mute and share their experience of how it's gone in your system. And we had some really interesting conversations in the last workshop around what is the role in the ICS of sort of setting standards and for what, in reducing variation and duplication, or is it just about kind of sharing good practice and supporting systems? And also questions about whether it would be helpful at a sort of national level to have kind of clearer targets or sort of benchmarking standards as ICSs develop. So any thoughts on that, or anything else would be welcome, Kate?
Yeah, I'm just quite interested because in our system, we are going great guns at trying to look at things like community therapies and levelling out, rebalancing, however you want to reframe that language around our patch. But I'm presuming that's happening in all the other, you know, I know we've gone bigger, but also everyone else is doing the, you know, I feel like we're all recreating the wheel again in our different, so where's that shared learning? So I get the shared learning now that we're joining together with other local authorities, but I'm presuming some people are further ahead in some ICBs or ICPs that could share some of that practice rather than going like, oh, we've done it this way and then somebody else has done it that way. And is there a, yeah, just curious to know how other people are experiencing, because I feel we're going at high pace, high speed, trying to do something without necessarily taking time to look at what's out there.
Yeah, absolutely. So some sort of national opportunities for sharing what you are all doing to reduce that duplication, not within an ICS, but sort of across country. That makes sense. Absolutely. And did you say in this workshop, Anna, about the West Midlands work, or
No, I didn't actually.
I don't know if that's a part of that kind of sharing good practice picture.
The West Midlands or the Midlands NHS region commissioned CDC to develop a session, training or information session for those exec leads on ICB boards about SEND. So very much kind of back to basics, what they must know about SEND. So we're scoping the curriculum out for that next week, and we'll be developing it and running a session in January. So I'll, yeah, if you're interested to be involved in scoping that curriculum out, then do just send me an email. We'll invite you, but I think it's back to, in the previous workshop, we had a participant who said that within their system, one of their local authority footprints was being inspected for SEND, and she didn't imagine that their exec lead for SEND on their board even knew that was happening. So it's about understanding the picture, I guess, and the context. I have put the evaluation form in the chat. Please do complete that when you get a moment. Any other thoughts, or is it lunchtime? I realise we've had your attention since 10 a.m. So okay. On that note, then let's wrap up here. We'll be sharing slides from all of the sessions this morning and recordings from this and the other workshops. So if you weren't able to join the other workshops, you can you can look at the recordings of those because there's some really interesting stuff. But thank you all for your participation, and we'll see you again soon.
Did you say the evaluation is in the chat? Is it? Where is it?
Oh, let me just copy that.
Yeah, we'll put it back down to the top so that you are back at the top.
And that's the whole day, not just the workshops.
Oh, right.
The
Okay,
morning sessions and plenary stuff as well. So that's
Thank
just
you.
been popped in the chat.
Perfect. Thank you.
Bye, everyone.
Thanks, everyone.
Thank you. Bye. Bye. Thank you.
Thank you. Bye.